Hi everybody and welcome back to my little YouTube channel. If you're new to this channel, my name's Amanda. I'm a diagnosed autistic adult and I'm 40 years old. I'm making these videos in order to help you. You might have autism or you might be waiting for an autism assessment. The waiting list for an autism assessment in the UK can sometimes be over 3 years. I'm not sure about other countries, but that's an incredibly long time to wait when you're needing help. And that's the point of me making these videos. So hopefully you'll find some help and inspiration along the way. In today's video, I want to talk about autistic burnout. Autistic burnout might be a thing that you've heard from textbooks or YouTube videos, or you might be experiencing severe exhaustion or depression or worsening anxiety, and you might have researched it yourself and you might be wondering, am I experiencing or am I going through autistic burnout? And if you've got autism or you're waiting for an autism diagnosis or you think you might be autistic and you've got worsening symptoms of anxiety and depression, or you might feel that you're just losing basic life skills such as remembering to brush your teeth or to brush your hair in the morning, for example, and just do basic tasks that are assigned to us at work, it could be that you're experiencing burnout. Now, all these things that I'm going to say don't necessarily point to you experiencing burnout. So I don't want you to watch this video and think, oh, I must be in burnout, so I must go and see my healthcare provider. But I would advise talking to friends and family if you're feeling worsening symptoms of depression and anxiety and seeking a medical assessment so that you can get the autism burnout clarified and you can seek appropriate help and advice. But I'm going to talk a little bit about burnout. I experienced burnout personally a few years ago, and it's this chronic state of exhaustion. So if burnout is something that you guys want to hear more of, keep watching. Now, you don't have to have autism, you don't have to be an autistic person in order to experience burnout. Even if you are just somebody that has anxiety or depression, or just somebody that isn't even diagnosed with any other clinical condition, it's possible for you to still experience burnout. But the point of this video and the point of me raising awareness with regards to autistic burnout is to try and tell people that autistic burnout affects us massively worse than most people in the general population that don't have autism. And I think that is a knock-on effect of us having to mask or camouflage our autistic traits our entire lives. So we're already in that perpetual state of exhaustion before burnout occurs. And sometimes it just takes one thing. Neurotypical people say it's the icing on the cake or it's the cherry on the cake. It just takes that one thing to just overflow our emotional capacity and everything just goes boom and we just shut down. And autistic burnout can be so awful to autistic people that it can often lead to feelings of detachment. What I mean by that, and I've experienced that myself, is sometimes we can feel like our brains are no longer attached to our physical body. And so we can lose the concept of time. So, for example, this Christmas period, I went through quite a stressful time. Although I am still suffering from the ongoing effects of burnout from a few years ago, and I'll get into that later on in the video. As a result of that burnout, sometimes when I get overwhelmed and I have meltdowns, I start getting a bit detached. Leave a comment below, let me know if you have felt that symptom too. It almost feels like I'm watching my life play out on a television screen or a computer screen, a bit like this YouTube video, you watching on this YouTube video. It's like I'm watching myself back in real time and I'm not actually here myself, a bit like the Matrix. And I think a lot of autistic people experiencing burnout go through that state of chronic detachment. And that feeling of autistic detachment where you feel like your brain's just not connected to your body anymore, and you just feel like you're meditating and you're astral projecting and you're no longer in control of your mind, is just the most awful feeling ever. But before we continue with this video, could I just ask a little please, a little pretty please? If you're watching this or you're a returning viewer and you've not yet subscribed, please consider hitting like, commenting, and more importantly, hitting that subscription button. It helps my little channel out so much, and I appreciate you all greatly. Now, I've just started the introduction to this video and I've not actually explained to people what autism is. Now, you might be watching this video thinking, I already know what autism is, Amanda. You've already explained it loads of times on your video, or I'm sick of hearing about what autism is. But there might just be those viewers coming to my channel for the first time that don't know what autism is, or you might be an employer to somebody that is a potential candidate that has autism, and they might be wanting to get a job, and you might be wanting to find out what exactly is autism. So autism is a neurodevelopmental condition. It's a genetic condition. It's passed on through the genetics. It's not something that can be cured, and it's certainly not something that we just grow out of. So it's with us for life, and it affects every single person differently, just like everybody else on the planet. And just like you, if you're watching this, I'm sure you have your own things that make you happy, you have your own things in life that make you sad and upset. You have hobbies that you enjoy, you have things that you hate, you have things and people that you just irritate you, that get on your nerves. You might have foods that you particularly don't like and you avoid, and that's just like autism. But a lot of the time with autism, we can take a lot of these things to the extreme, and I'll go into that a little bit in this video. But if I haven't gone into it enough, check out some of my other autism videos. Check out the one that says, what is autism? You'll find it quite informative. So I hit autistic burnout a few years ago. And I think I was around 37 years old, having worked in the health service for years and years, nearly 20 years. And I mingled with staff, I laughed at patients' jokes, I sat with them in my lunch break, I joined in at team meetings, and I did everything I was supposed to do. When something was asked, will you do this? I said yes, until eventually my autistic mask started to drop because I was just exhausted, and that's when problems started to arise. I was so tired, and I explained to my managers that I think I'm autistic, and I had a provisional autism assessment. And because I'd changed from this bubbly person to this quiet person, everybody misunderstood me at work. And what they didn't realise, and what I didn't realise at the time, was that there was an impending autistic burnout on the horizon. So what happened with me was I started feeling more irritable than normal. I mean, I can get quite irritable anyway because I have autism and I have lots of burnouts, so I can be quite irritable by nature. But my irritability started increasing and I started feeling more tired. I didn't want to get up for work in the morning, and I didn't want to go to work, and there'd be many times when I'd drive to work and I'd be in tears, I'd be absolutely exhausted, and I'd be crying on my way to work. And I'd get to work and I'd isolate myself from people, and people didn't know what was happening, and they thought that I had really bad depression. So I was referred to occupational health and the places that you get referred to when managers see that there's something happening in your life but they don't quite know what's going on. And I was provisionally assessed as autistic at the time. I had to wait 3 years after that to get my official autism diagnosis. But at the time, even the occupational health advisors didn't know that I was going through autistic burnout, and my anxiety was heightened. I didn't want to be around crowds of people because I felt overwhelmed by people making conversations and small talk with me. I didn't want to treat patients because I felt like it was just this conveyor belt of one patient after another, and at every single appointment I was having to mask and make the same conversation, the same greeting of the patient, the same thing over and over again throughout my whole day, this repetitive conveyor belt of masking. And everything was just building up for this massive explosion and burnout. So if you're autistic, or you think you might have autism, and you're feeling a heightened sense of anxiety, or you feel that you are depressed and everything just feels a waste of time, and you feel exhausted most of the time. And when I say exhausted, autistic burnout is chronic, perpetual exhaustion. It's an exhaustion that I can't even describe, where you won't brush your teeth, you won't brush your hair, you won't wash your pots. Basic life skills tend to go out the window and they just get neglected. And my exhaustion, at one point I was on the floor in my bedroom and I just couldn't move. So if you're feeling that you've got heightened anxiety, or you've got depression, and you feel that your symptoms are worsening, and you feel like you're lacking the basic life skills that you once had before, it might not be, but it could be that you're going through autistic burnout. So it's always worthwhile just mentioning these problems, these symptoms, to your GP or your healthcare professional, and getting assessed so you can get appropriate support. And if you're avoiding certain things that you'd used to do in the past, like social gatherings, for example, friends and family, especially we've just had Christmas and New Year, if you felt like you just can't cope anymore with being around and mingling around people, or the small talk that people make is just too much for you now, it could be burnout. I mean, most autistic people are all different, obviously, but most of us don't like social gatherings and small talk. So just because I'm telling you this doesn't mean to say that you're going through burnout. But if you've just reached the point where enough is enough and you just can't do it anymore, it could be that you've been masking for so long that you just can't do it anymore, and you're going through autistic burnout. Other things as well is eye contact. People with autism find difficult, and I know when I was going through burnout, I wasn't able to make or maintain eye contact at all. It was already strained for me, but it was massively overstressful when I was going through burnout. And so if you're finding that your autistic traits, your personal autistic symptoms, have become exaggerated and have worsened and heightened and got much worse, it could be that you're going through autism burnout. And if you're experiencing autistic burnout, I want you to just take a little bit of pressure off yourself and know that what you're going through is perfectly normal. Well, not normal, but it's part of our coping mechanism with our autism. We've worked so incredibly hard, harder than most neurotypical people that don't have autism, for all our lives. We should get paid danger money in every aspect of our life for working so hard that our battery's just been completely depleted. And so we've not recharged our batteries. We've been working on empty for years and years in some cases, without being recognised as autistic or receiving adequate support. And so it's not your fault, and it's not my fault, and it's not our fault with autism if you're experiencing burnout. The problem arises with telling other people that we're experiencing burnout and gaining understanding and support from those around us. The first thing I would do is just try and speak to family and friends. And you know what? Sometimes not everybody has family and friends that's supportive, and there's nothing wrong with setting boundaries and saying no to people and just spending some time on your own away from others. I hope you guys have enjoyed this video and it's helped you to better understand a little bit about autism, and more importantly, autistic burnout. And if you're going through autistic burnout, I want you to know that you're definitely not on your own. I've been there, and it can have long-lasting effects. Sometimes autistic burnout can last weeks, sometimes months, sometimes years and decades, and the long-lasting effects can be even longer, sometimes a lifetime. But you're never ever on your own, and hopefully by subscribing to this channel you'll get more information about autism and we can make friends along the way. So if you've enjoyed this video, please consider hitting like, commenting and subscribing to help support my little channel, and I'll see you next time for my next autism vlog. And do what I do, go outside in nature, feed the birds, just get the fresh air. Do your special interest. Do what you like doing and don't be told by other people what you should and you shouldn't do. There's nothing wrong in being yourself, and you're just a perfect person exactly the way you are. Take care, guys. Bye. And the last thing I want to say is, if you're going through autistic burnout, I want you to know that you're never ever on your own.